Hello everyone, welcome at SudhirEyeCoach, a channel for budding and emerging ophthalmologists. Today I am showcasing a case where pupil was not well dilated. It was around 4.5 mm and the patient had a moderate cataract, moderate nucleus, and in such cases careful planning and technique are very crucial. And if you are beginner, I do say that give proper anesthesia and you can use any pupil expander devices, but here I have not used any pupil expansion devices and I completed the phaco fragmentation with this moderate size of pupil. To manage this, I first used viscoelastics to gently stretch the pupil and created an optimum sized capsular axis of around 5 mm. A good hydrodissection and delineation are essential to ensure clear separation between the nucleus and epinuclear plate and from the posterior capsule. For phaco fragmentation, it's important to keep the phaco tip exactly in the center, and the best technique in such cases is to hold and split method, keeping the tip stationary while using the second instrument to bring pieces closer, hold them firmly and split them sufficiently and efficiently. Throughout the procedure, maintain patience and precision to avoid complications. In cases of iris flutter, use viscoelastics intermittently and always keep the phaco tip parallel to the iris to prevent sudden pupil closure caused by fluid accumulation behind the iris. So do not bring your phaco tip behind the iris plane or behind the capsular axis margin. Watch the video to see how I handle this case smoothly. Feel free to share your thoughts and questions in the comments. Learning is a continuous process and discussion helps refine our techniques for better cataract surgery outcomes in the future. Thanks for watching.